Hi, Dr. Tim St. Onge with Thrive Chiropractic in Branson, Missouri. Today I want to talk to you about your spine and what causes it to degenerate and what causes it to be healthy. Your spine is made of 24 bones called vertebrae, which stack on top of each other in the form of a column. The top 7 bones are referred to as the cervical spine. The next 12 bones are called the thoracic spine or thoracic vertebrae. The most notable thing about the thoracic vertebrae is that each bone has 2 ribs that attaches to it, a right and a left. The next 5 bones are called the lumbar spine. Below the lumbar spine is the sacrum, which is made up of 5 bones that become fused into one bone pretty early in life. Then below that is the coccyx, or what most people refer to as the tailbone. Attached to the bones of the spine are 4 layers of muscles. The muscles are responsible for creating joint stability so the joint doesn't dislocate, posture so that you can stand up against gravity, and movement. If you look at the spine from the front, it should be straight up and down. Any sideways curvature is called a scoliosis. A scoliosis is not desirable and will usually lead to problems at some point. If we look at the spine from the side, there should be 3 curves. The cervical area should curve to the front, the thoracic area should curve to the rear, and the lumbar spine should curve to the front once again. These curves help to create shock absorption for the body and are required to maintain proper disc health and spacing. When you move your neck or back, the motion that you experience is actually an accumulation of motion from many joints. Each joint in the spine has 6 degrees of motion: flexion and extension, right and left side bending, and right and left rotation. For the spine to maintain health requires that each joint in your spine maintains normal alignment and mobility relative to the bones above and below. So when we talk about spinal health, we must talk about 3 different characteristics: alignment, mobility or range of motion, and strength. Strength is important because maintaining good posture requires strong muscles. Of course, we understand that most people who go to the chiropractor go because they want to get relief, and that is certainly understandable. But I want you to understand that it is not so simple as popping a pill and making the pain go away. We want to actually get to the root cause of your problem, and most commonly, the cause of back or neck pain is a spine that is not functioning properly. A spine that has lost one or more of the following properties: alignment, mobility, and strength. In the next email, we will talk about what we are doing to improve those 3 properties of your spine so that you can experience a pain-free, high-energy life and get good restful sleep to boot.